As fuel, medical supplies, food and water grow ever scarcer in Gaza, those in the enclave are facing a humanitarian crisis that the UN Population Fund says has reached catastrophic proportions. Among them are an estimated 50,000 pregnant women. Many have been displaced and are living in dire conditions.
Many of them huddled in unhygienic, overcrowded, displaced shelters. Many of those shelters are subject also to the bombardment and certainly to the harassment and the difficult circumstances that have been imposed on them as a result of the Israeli bombardment. There is no clean water. We estimate that over 70% of the Gazan Palestinian population has no access to clean drinking water.
According to the UNFPA, around 180 women are giving birth in Gaza every day. But with hospitals in the enclave no longer functioning or overwhelmed with casualties and lacking supplies, many are cut off from safe delivery services. Their children's lives are also at risk. Over the last week, 8 babies died at Al-Shifa amid lack of electricity for generators and medication.
Many of the hospitals that are supposed to be a place of protection, refuge, care for the ill, the sick, the injured, and certainly for any woman seeking health care, they have been turned into a death trap.
Amid Israel's bombardment of the enclave following the October the 7th Hamas attacks, the organisation says it has had difficulty even finding many of the women in need of medical aid. A ceasefire, it says, is the only way it will be able to reach those who are most vulnerable.
We require unhindered access in a safe environment. That requires 100% ceasefire, not a pause, not a corridor.
A sentiment echoed by Antonio Guterres. On Sunday, the UN Secretary-General called once again for an immediate humanitarian ceasefire, describing the civilian death toll in Gaza as staggering and unacceptable.